we all feel as a collaborative effort that we're being kicked to the curb. We're being kicked out, and it hurts.
A Sacramento health center that's been serving the HIV community for decades is going through changes that are upsetting the very population the clinic was built to care for. The Center for AIDS Research and Education, also known as CARES Community Health Clinic, is changing its name and refocusing its brand.
New tonight, CBS 13's Sharon Roger is live from the clinic on 21st Street in Midtown Sacramento with both sides of this issue. Sharon?
Tony and Christina, for decades, this Sacramento clinic has been known to serve HIV patients. Now, in 2014, they did expand to CARES Community Health Center, serving more than just HIV patients. But today, they saw a big change in identity, and the reaction to it was not a quiet one. A small group of protesters chanted outside CARES Community Health Center in Sacramento as signs were brought down and the name of the clinic was changed without notice.
I'm speaking for the whole community of HIV and AIDS that have depended on this clinic for over 20 years.
Irene Ross is HIV positive and has been using the CARES Clinic since it opened decades ago as a center for those with HIV. She says seeing the clinic get rid of the color red in their logo, which represented the fight against AIDS, and the word CARES, which stood for the Center for AIDS Research and Education, is hurtful.
We need a safe haven. We need somewhere where we can go.
For Irene and others, these changes were abrupt, but CEO Christy Ward says they're not turning their backs on their patients.
Those patients that are living with HIV will always be here for them.
Ward says services for HIV patients will continue, but the center is rebranding in order to serve a broader population of patients in need of medical care.
The idea is that we are being inclusive and we want everyone to come into our community.
They still provide us services, but you can tell the atmosphere is just not the same.
Ward says in 2016 they served roughly 2,500 HIV-positive patients, and that number went up to 2,700 this year. But with 5,000 additional non-HIV patients now added in 2017, getting appointments has been challenging, and that shift in care felt most by the original patient population, who now demand answers.
When are you going to step up and talk to us, the community, the HIV community, who this clinic was built for?
Now, to meet the demands of their expanded patient pool, just today they opened up a new clinic in the Art and Arcade area, and this main center here will be moving into a bigger building come January so that they can get patients into those appointments quicker.
Sharon Roger live in Midtown Sacramento. Sharon, thanks.